the confidence. Now imagine if the front teeth are not there and your kid goes out and he's being like, teased around, कि अरे तेरे दांत नहीं है, काले हैं तेरे दांत. It hampers the kid's confidence. So definitely good set of primary teeth are so important in building the confidence. Apart from that, they are also required for the proper development of the permanent teeth. Now, because our permanent teeth develop below the primary teeth or the milk teeth, so if your milk teeth aren't healthy, your permanent teeth can never be healthy because the infection from your primary teeth can directly go into your permanent teeth. So these are the top 5 reasons why your primary teeth or milk teeth are as important as your permanent teeth. Aparna?
Unmute. Now is I'm audible? Hello?
For now, we can hear you.
Okay. Sorry, there was some connection problem. There was some error was coming. Sorry, Dr. Surbhi.
No problem. You can come.
Aparna, are you back with us?
Yeah, now I'm back with you. And I'm trying to start my video as well. If Stuti can allow. Okay, leave it. I think there are some issues they can handle. So, anyways, Dr. Surbhi, yeah, Stuti,
help me out?
If Stuti can add my video as well, because I'm trying.
Your video was already added. There's some technical glitch from your side, I guess. So let's continue. You can switch on your video once.
Okay, fine.
I mean, you can try once more, or else we'll continue.
Okay, sure.
Aparna, we can't hear you.
Now you can hear me? Hello, Dr. Surbhi?
Yes, you're audible, Aparna.
Yeah. I think I'm audible. Yeah. So since you already described that a lot of parents want to know.
Can you please help me out at this stage?
My voice is not coming or it's not clear?
Well, till we have Aparna back with us,
yes.
Let's continue a little bit about more on primary teeth. Now,
Dr. Surbhi,
when do primary teeth start to fall? Now, primary teeth usually start to fall after the first permanent tooth has come in your mouth, which is after the age of 6 years, that is approximately from 7 years onwards, is when the first tooth starts falling. And that's when you know that your permanent teeth have started coming. So which are the permanent teeth that first come? These front ones are the ones that come first. And that is when you know that your child has started moving into or transitioning into the permanent teeth stage. Now, what care do you require at that point of time? Well, there are multiple things that you need to take care about. First, have a scheduled visit with your dentist or a kid specialist dentist so that the permanent tooth that has come at 6 years of age can be checked. If that tooth requires some treatment, that is given. Second, and the foremost, is that you need to ask your kid to brush their teeth properly. Till your kid cannot tie the shoelaces, please see to it that you assist your kid in brushing at least at night. During the daytime or in the morning time, let them, develop their interest, give them the things, but till 6 years of age, see to it that the night brushing is monitored by you. The third and foremost is you need to check their diet. Now, if their diet has a lot of sugary stuff in their foods, like if they're taking a lot of chocolates, if they're taking a lot of processed foods, and if they're taking at multiple intervals, they are proving or proning themselves or putting themselves at a higher risk for cavities. So the diet is also equally important that you need to take care of. Apart from this, At the age of 7 years is the time when another dental visit should be scheduled in order to know if your kid will require braces treatment, because that's the time when we know your kid may require. So 6 to 8 years is the best time you really need to visit your dentist in order to protect your kid's teeth for the future. Now, what are the reasons for the, where you have to remove the primary tooth? Now, there are times when the primary tooth will have to be removed. The first and foremost reason is when the tooth has developed a cavity and it is at a stage where we cannot either do a filling or we cannot do a root canal and save that tooth. So for that, in those situations, it becomes, impossible for us, other than the fact that we have to remove it. Apart from that, another reason or the other place when we have to do extractions of primary teeth is when your kid is going to require a braces treatment in the future. So the planning of that starts from the age of 7 years. So sometimes during that time, you need to remove few teeth to make space for the permanent teeth to come at their right positions. So these are the two major reasons when you actually need to, get the tooth out. One, when the infection or the cavity is so bad that we cannot save it, and there is a lot of pus and infection. The second is when you're planning for a braces treatment and you want certain teeth to come in their proper position. So that all is decided by your dentist in that age group of 6 to 8 years of age. Aparna or Stuti, do we have you with us?
Yes, we do have Aparna. Aparna, could you please continue?
Aparna, you're still not audible to me. Okay, now what happens now as the permanent teeth have started coming into the mouth? There can be times when the permanent teeth comes behind your primary teeth. More commonly, this happens with the front teeth, the front lower teeth. In what do you do in such situations? So in such situations, what you really need to do is that have patience, wait for another 2 to 3 months. If the primary teeth or the milk teeth do not fall down by their own, then please take your kid to the dentist so that they can get those milk teeth out, and the permanent teeth can come or move forward into their position. So this is only taken, the decision will be taken by the dentist. But please keep in mind that if the permanent teeth are coming behind the milk teeth, wait for 2 to 3 months, because most of the times the milk teeth will fall by themselves. But if they don't, your dentist will help you, guide you through it, and probably even advise you to get them out so that the permanent teeth can come back into their position.
Okay. Hi, Dr. Surbhi. I think now
Stuti?
I'm audible. Hi, Dr. Surbhi. Is I'm audible?
Aparna ma'am, I really can't hear you still. Is that only me or
Uh,
is that other people also?
No, Dr. Surbhi, we can hear her. So I think there is some problem from your side, I guess, because I can
Uh,
see Aparna.
can other people please help me
uh,
out if they're able to hear Aparna ma'am, or it's only me
I
who's I'm
can.
not able to hear her?
No, I can hear you. You are perfect. Like I can hear you. Just let me know if I am audible to you.
Yes, yeah, there was some glitch probably my side. You're audible now. So sorry, Aparna.
I'm audible. It's fine,
Yes,
Dr.
yes.
Surbhi. First of all, I'm really sorry for what uh, happened. So first of all, thank you so much. Whatever you briefed, I completely heard what you said. So people also wanted to know that when do these primary teeth fall and what care do we require at the time, or do we really require any care at the time, or it's like optional?
No, definitely. So primary teeth start falling down from the age of 7 years. That is after the first permanent tooth comes into the mouth. So the first permanent tooth comes in a mouth somewhere around 6 years of age, which depends because in girls they come out pretty early and in guys they come out a little late. But on an average, if I say 6 years to 7 years is the time when the first permanent tooth comes. And it's only after that will the primary teeth of the front start falling down. So the care that is required at that point of time is more because your permanent teeth are going to last you for like a lifetime. So the care has to start from that time. Definitely, it is advisable that we have to visit the dentist, take the kid to the dentist, so that the kid first of all gets acclimatized to the surroundings. Secondly, the dentist can guide if the kid will require a fluoride treatment to protect the permanent teeth that have come. Secondly, any modifications in the brushing that will be required, any dietary changes that should be done. This definitely even the mom and dad can take care of it. Most importantly is that they should avoid giving their kids a lot of sweets and at frequent intervals. If the kid really likes a chocolate, they can have it at a meal time, that is at lunch, dinner, or even at breakfast, but not in between the meals, so that the cavity risk goes down. Apart from this, definitely the dental visits can guide you in future if you require a braces treatment or something. So all of that is going to be taken care of in the age of 6 to 8 years. And the dentist and the parents play a major role in the development of the best or the good quality of teeth for their kids.
Yeah, that's true. That's true. Yeah. Thank you, Dr. Surbhi. So, as you said that it's really required for the parents and the dentist to take care of that. So, there is like what are the reason for the extraction of primary teeth at a particular age of like 5 to 12 years?
So there are two major reasons why we need to take out the teeth of a kid. Now, the first and the foremost reason is when the tooth has developed a really bad cavity, and the cavity has involved the nerves, it has involved the bone inside. The infection has spread basically from the tooth inside the bone, and the tooth is in a state where we neither can do a filling or neither can we save it with the root canal treatment. The only option that is left to us will be removal of that tooth. The other time when we need to actually plan a removal is when the kid is requiring a braces in the future. So when the kid comes in the age group of 6 to 8 years and we evaluate it, we know that this kid will require braces. But because we want to shorten the braces, treatment period time, so we plan the extractions in such a way that the permanent teeth come at the right positions that we want them to. So which we call it as serial extraction. So these are two scenarios wherein in the age group of 5 to 12 years, we need to extract the primary teeth.
Okay, okay. So that's the main reason why you are putting a age limit, like so that the permanent teeth will,
yes, so
will
because
come at
all
the same time.
Teeth, yeah, so all the permanent teeth are usually in our mouths by 12 to 13 years of age. So that is why this like 5 to 12 years is the transition time from the primary teeth towards the permanent teeth.
Permanent teeth. Yeah, that's
yes.
right. Okay, okay. So that's perfect, and thank you so much. And the next question is if anyone from the audience would like to ask any question, otherwise we can continue like what is the extensive decay and when is the pulp treatment for extensive decay in primary teeth is really required for the kids?
Right. So our teeth have three layers. The outermost is the most strongest structure that is present, but at the same time, it is prone for damage because of the frequent sugary items that we eat. The second layer is a very important layer, and the third layer is where the nerves are present. Now, whenever a cavity starts, it will involve the first layer, if not noticed at that point of time as a black spot or even a hole, then you move into the second layer. And even after the second layer, it moves into the third layer. So when it reaches the third layer is the time when the problem is going to start. The child will complain of pain. He will either have a swelling or he will say that I'm not able to eat anything. And that's when you will require a pulp treatment or a root canal treatment. And nowadays, root canal treatment in a kid is very common and done in a really painless manner.
Yeah, that's true. It's really painless. So what you recommend, like a root canal is better than like a pulp treatment and the other treatment?
So pulp treatment is nothing but a root canal treatment itself.
Same.
Based on at what stage either we are treating a permanent tooth or we are treating a primary tooth, we really have to take a call because a lot of factors are taken into place. If it's a permanent tooth that requires a pulp treatment, then we really need to look into the factors, whether the tooth has been completely formed or whether we require an intermediary treatment now and then plan after, like, 6 months. So everything has to be planned out based on what we actually have when the patient comes to us. But pulp treatment or a root canal treatment is nothing to be worried about at this point of time. But yes, they can be avoided with good care at home.
Okay. So thank you, Dr. Surbhi, for this detailed, your perspective. Just one last question. What is the treatment of traumatic injuries in the primary dentition and what happens if it gets delayed or not at the same time?
Okay. Now, most of the times our kids are like running around and, either of some of them are into sports. So the best thing is if you put your kids into sports like cricket or karate or something wherein they have a chance of falling, the best way is to prevent that by giving your child a mouth guard. Okay, so that is like a covering that is present on all the teeth. So even if a kid falls, the guard takes up the impact rather than the teeth. So the teeth are saved from having any traumatic injuries. But in a scenario where the traumatic injury has already occurred, then in those cases, what can be done is that within 30 minutes, please visit the nearby dentist. Apart from that, the tooth that has, suppose if it has come out of the mouth, keep it under the tongue. If the kid is big enough, they can keep it. If not, buy milk from anywhere and carry it in the bag in that.
Okay.
So that's the best way you can preserve the tooth for 30 minutes to 1 hour. Come to the dentist immediately and tell over the phone that this is an emergency thing and you have to visit him ASAP or her ASAP. They will make the arrangements. And what can be done is either the same tooth can be put back inside the mouth or in can be planned for something else. So all of that scenarios are taken into consideration based on how dirty the tooth is, how long duration has it happened from the time of accident. There are multiple factors that go into deciding what would be the treatment. But yes, traumatic injuries, those teeth can be saved in the later parts, and definitely it can give back your smile.
Okay, that's perfect. So thank you, Dr. Surbhi, for having you and for having a wonderful talk by you. I hope that all the guests have enjoyed, and they shall tell others that what is the importance of the finely tooth and what care it's really needed. So I hope all the guests has enjoyed. So here we are going to summing up, wrapping our talk and Potpourri talk, and hope to see you again in our Potpourri group and talk show.
Sure.
Thank you so much, Dr. Surbhi.
Thank you so much for having me. It was a pleasure talking to all of you, and I hope to have to be back on this platform again.
Yeah, sure. Thank you, Dr. Surbhi.
Thank you. Yeah, thank you.